Today, we're going to talk about how to obtain a patient's controlled substance prescription history in the Alabama Prescription Drug Monitoring Program. In the PDMP, this function is called a patient request. Your regulatory board may have rules that dictate when you must search a patient's controlled substance prescription history. These regulations are usually posted on the regulatory board's website, or you can call the board if you are unfamiliar with these requirements. Now let's walk through the steps of making a patient request. You will need to log into your PDMP account by entering your email address and password. If a password reset is needed, use the password reset link. Once you're logged in, click on Menu and go over to the RX search. Under this heading, you will click on Patient Request. Enter the search criteria. At a minimum, you must provide the patient's first name, full or partial, and last name, full or partial, as well as date of birth. If you're intending to use the partial search, be sure to click on the box indicating partial search under each one you are using this option for. The date of birth must be included 2 digits for the month, 2 digits for the day, and 4 digits for the year. You may also select a date range for the date of birth by clicking on the drop-down button in the date of birth range field. You can choose between an exact date of birth, within 6 months of the date of birth, within 1 year of the date of birth, or within 2 years of the date of birth. Keep in mind that increasing the date of birth range may result in multiple patients being identified in your search, especially if the name is not unique. Other patient demographic information, such as a social security number, may be entered but is not required. The prescription fill dates auto-populate to 2 years. You may edit these dates, but a minimum of 2 years is required for a patient history report. A date range of up to 5 years plus current year can be entered. This field uses the same date format as the date of birth field. The patient's address may be entered under patient location but is not required. The Alabama PDMP has data sharing agreements with over 30 states and territories. These states are listed in the PMP Interconnect search section. The states that are displayed are dependent on your role designation and the laws of Alabama and other states. To search the PDMP in other states, click the box beside the state. The more states that are searched, the longer it may take your report to run. Also, you should be aware that the system searches other states by exact first and last name and exact date of birth. The last step before running your report is to check the acknowledgement box. This certifies that you agree to the terms of the acknowledgement. We encourage you to read the acknowledgement before performing your first patient request. To run your report, click the search button. If multiple patients are identified, you will be provided with the option to refine your search by providing additional search information, or you can select single, multiple, or all returned patient groups to include in your patient RX request. A screen will display showing these results. If you would like to return to the patient search screen to enter additional information, click on Refine Your Search. Otherwise, check the box beside the patient or patients you want included in the report, then click Run Report. The patient's controlled substance prescription history will be displayed in a NARCS Care report. Patient searches are saved in the PDMP database under Request History. Using partial spelling can be helpful for hyphenated or commonly abbreviated names, such as Will for William. A minimum of 3 letters is required for a partial search. Please note that if you enter partial spelling, you will be unable to select other states to search through the PMP Interconnect search feature. If you have questions about registering for the Alabama PDMP, visit our website at alabamapublichealth.gov/PDMP or email us at pdmp@adph.state.al.us. Thank you for your time and your attention.